I'll go ahead and first introduce myself, and then Dr. O, if you want to go next. My name is Tyler Ketterl. I am a pediatric, adolescent, and young adult oncologist. I work predominantly at Seattle Children's, but also do some work at the Fred Hutch as part of my research. And a lot of my research has been in the area of body composition and changes in survivors of bone marrow transplant. So I'll be speaking first this morning, talking about some of the impacts of cancer therapy and bone marrow transplant on body composition. Dr. O?
Hi, everyone. My name is Hanna O. I'm a rehabilitation medicine doctor at Fred Hutch. My clinical practice is focused on treating any changes in mobility or function that can occur during treatment and after treatment. And a lot of that is focused on exercise and physical function. So I'm excited to talk a little bit about exercise following transplant.
Excellent. And I'm going to go ahead and advance my slides. Everybody can see that my slides okay? Hannah, can you see them on your end? Perfect. All right. So our overview, we're first just going to start by talking about the effects of cancer treatment on the body. And then we'll talk about ways which you can incorporate exercise or into your day-to-day life or an exercise prescription. And then finally, different types of exercise. And as you've heard before, these presentations are being recorded for future use. And then finally, the land acknowledgement that the Fred Hutch Cancer Center sits on traditional land of the people of Seattle, the Duwamish people, past and present, and honor with gratitude the land itself and the Duwamish tribe. So when we think about cancer survivorship and this period, it really is not just one point in time. There are unique issues that really come in that very early period right after cancer-directed therapy is completed. There's the next kind of that first year, which can be very intense with very, very close monitoring. And then there's really that much later long-term issues that we think about. So the 5-10 years out from cancer therapy or bone marrow transplant. But really, there's a role for exercise in each one of these different phases, and exercise might change, or what it might look like, or what your body is capable of doing can be different at any of these points. And really, we hope that we can find ways to adapt exercise into each one of these different periods of cancer survivorship. So first, I just want to take a big step back and talk about what are the effects of cancer treatment on the body. And so what are these acute responses, or really short-term initial changes that we can see? One of the first things that we know can happen is that there can be a change in the body composition. And I'll go into that a little bit more, but one of the things that we see is there's an increased percentage of body fat, or a ratio of body fat to other muscles, or other compartments like bone or muscle. We also know that during cancer treatment, many times patients will take in high calorie foods. We're trying to maintain nutrition. And so the type of foods that people consume during this period of time can dramatically change from what their regular diet can be. Many of the medications or radiation that we have can have impact on the organs, such as the heart, and can cause cardiomyopathy, or impaired squeezing of the heart muscle. We know that due to different types of surgeries, just overall feeling sick from side effects, that there can be decreased strength and mobility limitations. And then for our younger patients, there can be changes in parenting. And so what parents offer as far as food or activity or schedules and routine. And these things can lead to other downstream effects. So these can lead to longer term increased caloric intake and poor diet quality. It can lead to decreased physical activity. And so what can happen are the longer term effects of this that persist into that later survivorship period is that we can see higher rates of obesity, higher rates of insulin resistance, meaning the body needs more and more insulin to bring the blood glucose level down to a normal level. We know it can lead to dyslipidemia, which is referred to as, is another term for the LDL or bad cholesterol, or high cholesterol being in very high or very low ranges that put the body at risk and finally, hypertension or high blood pressure. And these things all together can increase one's risk for cardiovascular disease. And this can ultimately lead to early onset cardiovascular disease and other morbidities. So we've actually looked at this and these longer term effects in pediatric bone marrow transplant survivors. And what we did is we took 151 pediatric bone marrow transplant survivors, and we brought in 91 of their siblings, and we did a full analysis on their blood, their body composition using a DEXA scan. We had an interesting finding. This was almost 10 years out from a bone marrow transplant. And what we're able to see is compared to their siblings. So if you can imagine this dotted line across is their patient's siblings. When you look, their body mass index, which takes into account just height and weight, was not really different from their siblings when we looked at it. And we looked at the type of conditioning regimen patients got for their bone marrow transplant, TBI to the brain or CNS, central nervous system, or just TBI that didn't get a boost to the central nervous system, or those who just got chemotherapy alone. So looking at the BMI, we did not see a difference. However, when we use the more kind of advanced techniques of looking at body composition, so using a DEXA scan, what we found is that patients actually had a significantly lower amount of lean body mass. And what we mean by lean body mass here is really muscle. And that was particularly true for patients who received the total body irradiation. And when we looked at percent fat mass, we saw that all groups, it didn't matter what type of conditioning patients received for their transplant, all had higher fat mass. So we thought this was really interesting because while we are used to using BMI in clinic, we're finding that there's kind of a muscle deficit that we're seeing that's persisting much longer into the survivorship period than we had anticipated. And so the kind of takeaway from this slide is that there's a higher percent fat mass and lower percent lean and lower lean body mass compared to sibling controls, despite having a similar body mass index or BMI. And so what we know is that there's an increased rates of obesity in childhood cancer survivors. There's increased risk of metabolic syndrome in childhood transplant survivors and early complications from cardiovascular disease in pediatric and adult transplant survivors. And I should mention, there is increased risk of metabolic syndrome in adult transplant survivors. And when I say metabolic syndrome, again, what I'm referring to is this concept of visceral obesity, which is fat around the organs in the abdomen and the chest, insulin resistance, where the body needs more and more insulin to bring the glucose down, hypertension or high blood pressure, high triglycerides, and low HDL cholesterol, which is sometimes referred to as good cholesterol. So when I was mentioning before about these different compartments of the body, we're able to use different imaging techniques to look at the different compartments in the body. So what I'm referring to here is how much water is present, how much muscle, how much bone, and how much fat is present on the body. What happens after cancer therapy is these are two DEXA scans here, is we can see that after cancer therapy, some common findings that we have is decreased amounts of muscle, decreased density in the bone, and increased amounts of fat. So if we're looking at these two individuals here, this yellow color represents increased amounts of fat. The decrease in the kind of bright whiteness of the bone can represent decreased bone mineral density. And then the kind of reddish color or deeper orange, I guess, would be muscle that's present. And so this is the common changes that we can see in some cancer and transplant survivors. So ultimately, one of the concepts that we think about is this kind of sickness, wellness, fitness continuum. And this is a continuum, meaning you can move from different areas. And you might start at one point and be in the wellness continuum, and then during your cancer therapy, undergo into the sickness area. And then hopefully what we can do is provide, exercise recommendations, nutritional supplements, vitamins like vitamin D to help move, and medications to lower triglycerides to help move more into the wellness and fitness spectrum. And so some of the things that we think about are blood pressure, body fat, bone density, triglycerides, cholesterol, flexibility, muscle mass, etc. All of these things are modifiable factors that we can help and provide recommendations or exercises to help move to being more well or in that fitness spectrum. So I'll turn it over to Dr. O, and she'll talk a little bit here about how exercise can be used as medicine.
Great, thanks for starting off this talk. We'll switch gears a little bit and talking about specifics of types of exercise, frequency of exercise that we know can be beneficial in treating some of the side effects of cancer treatment. But first, I want to start by defining what physical activity is and what exercise is, because a lot of times we use these terms interchangeably. And physical activity is any movement of the body that expends energy. So that can be getting dressed in the morning, taking a shower, household chores, or walking the dog. Versus when we talk about exercise, this is a type of physical activity that are planned, controlled, and repeated for the sake of reaping some sort of benefit of that physical activity rather than completing the task itself. And overall, we know that exercise in certain quantities can maintain or improve our overall physical fitness. So the title of this slide, Exercise is Medicine. This is a commonly kind of used phrase. But my follow-up questions to that is that, you know, how should exercise be prescribed? Just like when we're given a pill or a medication, we're given information regarding the dose, how often to take it, what side effects to look out for, and how do we know if it's working, or what is it being used for? And in that same way, I think there's just so many different types of exercise that we need an exercise prescription that is tailored to an individual to meet individual needs as well as achieve a specific goal. And it may not necessarily be something athletic per se, but can be being able to navigate the stairs in one's home without being short of breath, or being able to walk a full block. So when we talk about exercise in the next few slides, hopefully we can talk about the different types of exercise and how they can be beneficial, how we know a certain dose or frequency of exercise is working and what works for you, and side effects to be mindful of. The American College of Sports Medicine convened a roundtable of exercise experts a few years ago, including the American Cancer Society and National Cancer Institute, and they looked at all the literature and studies that have been done on exercise in patients with cancer. And in reviewing all of these studies and literature, they summarized this, and we're able to find that these exercise studies showed improvement in fatigue, quality of life, physical function, anxiety, depression, and lymphedema, which is a type of swelling that can occur in different types of the body. They also found that exercise can be really helpful in decreasing the risk of certain types of cancer. And when they looked at these different exercise trials, they looked at a mix of aerobic only studies, resistance only studies, as well as a mix. And the overall recommendation is to try to do 150 minutes or at least 150 minutes of moderate intensity exercise a week, as well as 2 resistance training sessions during the week. And we'll talk a little bit about what this can look like in the next slide. So rather than telling individuals to do a certain amount of repetitions, walk a certain distance, or spend a certain amount of time each day exercising, we found that individuals are pretty good at gauging their own perceived self-exertion. So we know when we're doing something, giving something a 10 out of 10 effort versus like not really giving it enough effort. So in these studies, we've tried to find what is that sweet spot or what is that zone of being able to reap the benefit from an exercise without having side effects. And those side effects we want to look out for is worsening fatigue, muscle soreness that doesn't go away after a day or two, an orthopedic injury, or just utter exhaustion that you can't do any of the other activities that you have planned for that day, which would be in that physical activity category. So given we're pretty good at gauging our own perceived self-exertion, the general recommendation is that if you're exercising, to make sure that your perceived self-exertion is under a 6 out of 10. So you're still reaping the benefit of the exercise, but not going kind of overboard. We also divide exercise into 3 different categories of intensity: light, moderate, and vigorous. Light intensity is characterized by any activity where you're still able to sing a song, but are moving a little bit more than you normally would. So this can include slow walking, light housework, or Tai Chi. Moderate intensity exercise, and that's that recommendation from the American College of Sports Medicine, is any exercise where you're still able to carry a conversation. So this can be brisk walking, gardening or yard work, or biking on flat ground. Vigorous intensity exercise is typically if you're past that 6 out of 10 self-exertion rating and are huffing and puffing or can't really carry a conversation when you're doing that activity. Generally, if there's been a change in medical status or you're getting back into exercising, general rule of thumb is to start low and go slow in that light and moderate intensity category. And next, we'll talk about different types of exercise. So again, that recommendation of 150 minutes a week of moderate intensity aerobic exercise is what's recommended in kind of the survivorship realm of cancer treatment to decrease the side effects of which can include fatigue, improving physical fitness, anxiety, depression. So that can look like 30 minutes of brisk walking 5 times a week, but also being mindful of all the other physical activity functions that you have to do during the day. With that said, if you're walking 20 minutes a week, you should not jump into doing 150 minutes the next week. A lot of times we'll think if we walked 1 block the next day, maybe we'll add on another block, but we have to be mindful of the percentage of increase in activity per day or per week. And my general recommendation is that we never really double that volume, like we don't double the repetitions or we don't double the distance, but stick to increasing maybe by 10 to 15%. So even if we're, talking about walking a block, don't double the block, but maybe increase a house or, a few steps in terms of how long your walk is versus doubling any distance. The 2 other types of exercise we'll talk about are balance training and resistance exercises. Balance training can be really helpful in decreasing the risk of falls, as well as treating the side effects or the functional effects of change in balance from peripheral neuropathy. And the example I typically give is that figure skaters or gymnasts on a balance beam, they don't have incredibly strong foot and toe muscles, or maybe they do, but the reason that they can do their phenomenal stunts and tricks on a tiny surface is that they have a really strong core, which is the muscles around our abdomen, as well as muscles around their hips. So adding in some balance training to strengthen those muscles can be really helpful to maintain our balance and use a little less energy when we're walking on uneven terrain. And the last type of exercise I'll talk about is resistance training. The recommendation is to add 2 sessions of resistance training a week, and this does not have to include barbells or lifting large weights over our head. I recommend starting with just moving our own bodies. So this can look like just practicing getting up from a chair with or without the use of armrests or our arms for help. And this is actually my favorite exercise to do and recommend. It's basically a controlled squat that activates the muscles around our core which is the muscles around our trunk and our hips. And how and why it can be helpful is that a lot of times we're walking on flat ground and we'll notice that once there's a slight incline or even a step we have to navigate, that is significantly harder than walking for a long distance on flat ground. So we want to be able to strengthen the muscles around our hips to walk on uneven terrain, walk up hills, and navigate stairs. Similarly, when athletes are training, they're marathon runners or track athletes, they don't just run for training. There's some cross training involved. So resistance training is that cross training to make sure the muscles have the strength and the endurance to do the activities we want to do. Sarcopenia is defined as muscle loss that happens with age, as well as that can be expedited in certain medical conditions. And resistance training and building up that muscle mass can be helpful in slowing that decline. Other than resistance exercises or weight training exercises where we're moving our joints, there's actually exercises we can do where we're actually barely moving at all, but still expending a lot of energy and helpful in building strength. Those exercises are called isometrics. So an example of that is holding a plank position or like that push-up position. Even though we're not moving any of our joints or our muscles, we're still activating them and building muscle. Other examples of that are just standing with our feet together to improve our balance, or doing a squat against the wall where our knees are bent, but our back is against the wall, and practicing that for a few seconds. Not only is resistance training helpful in building strength, but we know that weight bearing exercises and resistance training is helpful to improve our overall bone health. And in the last slide, I want to share a little bit about the different roles and the roles of different members of the rehab team. When we think about exercise trainers, often we think about personal trainers that are working at a gym, but there's actually exercise physiologists who are specifically trained and study the side effects of cancer and cancer-directed treatment. A list of these trainers is actually available, I think, on the American College of Sports Medicine website. Rehabilitation medicine physicians like myself try to look at individuals or patients as a whole to see what exercise prescription can be tailored for an individual's goals and abilities. And a little bit about the therapy disciplines. Physical therapy often works on strengthening big muscle groups. And while a lot of individuals can do some self-directed exercise, supervision can be really helpful to make sure you're activating muscles in the right way, not causing any harm or orthopedic injuries. And they can also be really helpful in doing certain modalities such as heat, ultrasound, or laser therapies to also treat any orthopedic conditions limiting mobility. Occupational therapists work to optimize function when it comes to activities of daily living, and this can include bathing, dressing, toileting, as well as any functions you need to do to work or that are important to your day-to-day. And this can even include optimizing an ergonomic workstation setup with a computer to prevent pain or fatigue of certain muscles. And one type of exercise that I didn't touch on too much in this talk, or really at all, is exercises for the face and the neck for swallowing and speaking. Speech language pathologists, also known as speech therapists, are the experts in coming up with an exercise program or in evaluating how the muscles are working to project speech, as well as helps with swallowing, and can be really helpful to assess safety with swallowing and improve communication. And I think that's my last slide.
Excellent.
Does anyone have any questions?